Hello, it's Dr. Qureshi from the business of pet care. And today's topic I want to discuss is CIRDC. Everybody's seeing on the social media, pet owners, veterinarians, and it's really a mystery disease for a lot of people. People are thinking it's an outbreak, they see on the social media, is in the news, and people are wondering what's going on in that sense. So the question is, what are the symptoms? So most of the symptoms pet owner described is coughing, sneezing, nasal discharge, runny eyes, and just pet is lethargic. Maybe they're running a fever, not eating the food and everything, and people are getting concerned. And they hear from their friends, they hear from everywhere. So these are some of the signs. But looking more into it as a veterinarian, and I just read a recent article by Dr. Scott Weiss. He is an infectious disease specialist in Ontario, and he's known all over the world and all over North America. He was also consulted on when COVID happened with people. He was on the news with COVID. So he finally commented on Veterinary Information Network, and I read that article and his opinion. And he's saying that no one knows, is that a new disease or new symptom and everything. Because airway disease is very common in dogs and usually known as kennel cough. But this is, so according to him, first of all, according to him, it's nothing new. Nobody knows that it's new. There's still a lot of questions unanswered, but he calls it, or we call it, canine infectious respiratory disease complex. And what that means is not quite a kennel cough, which people see normally and maybe have taken their dog to a vet, but is more complex than that. So what are different organisms in that? So there are different viruses, which is canine parainfluenza viruses. There is coronavirus of dogs. There is bacteria, Bordetella, Mycoplasma. There are numerous viruses, bacteria, and so they're all involved in this kind of symptom. Why this is catching more attention? Because the coughing is lasting longer. Pets are more lethargic, and some pets are dying because of this. Consult your veterinarian, and when you go to your veterinarian, you should be asking them to do the testing. So what they will do is they will take a swab from the nose or the throat, and they will send it away for the diagnosis and see what it comes to. So you can test for different bacteria, you can test for some viruses. So you can run a test which, tests for 5 or 6 different pathogens or the organisms, and that will tell you what it is. But meanwhile, your veterinarian will examine your exam, and depending upon whether the pet is stable, not stable, they will treat with either antibiotics, or they may admit in the hospital to get it on the intravenous, and they will treat it accordingly, the symptoms and sign, the way the pet is exhibiting those signs. For the pet owners, when you take the pet home, or if it's treated with the antibiotic and everything, this condition can be highly contagious. So you have to isolate your pets. So do not take them in the park, boarding, grooming facilities, or to your friend's place or anything, because pets need to be separated. They'll get better, and that's the way it gets contagious. Now, how to prevent it? So if your pet is healthy and you worry about this condition and you see what you want to do about it, first of all, ask your veterinarian. But in my opinion, there is a vaccination available for kennel cough, and that covers more than 1 or 2 organisms. At least you can have the vaccine done. Also, what you want to do is, especially when you're taking your pet for grooming, boarding, and the dog park. A lot of the pet owners don't understand the importance of the vaccination for kennel cough, or now the kennel cough disease. In that vaccine, there are more organism included, so it prevents, again, viruses too. So, don't take your pet for grooming, boarding, or pet parks and all that if your pet is not vaccinated. And, also you want to make sure they're at optimal health. All the other vaccinations are up to date. And also the weight is good. They're eating a good, healthy nutrition. And they're not stressed due to any other reason, because stress also causes low immunity and they can get that disease. If you like this topic, please subscribe to my channel, put comments below. So if any question I did not cover and you want to know, then let me know and I can answer that in my next episode. Thank you.